We chose to study MS because it is one of the most common central nervous system diseases known today. About 2.5 million people are diagnosed, but what makes matters worse is that there is no said cure.
MS attacks the nervous system severely. What MS does is causes lesions in the gray and white matter in the brain, also in the myelin sheath of the axons throughout the body. This is where MS gets its name from, multiple scars. This causes the body's nervous system to work at a slower rate. As one can see in this picture, we have a damaged nerve caused by multiple sclerosis and a normal nerve. You can see that the myelin sheath around the damaged nerve is disrupted, causing the signals to be slowed down throughout the body, causing multiple problems throughout every system.
My name is Jen Zubkis, and I'm an intensive care RN. Essentially, it is your body releases an inflammatory response that attacks the myelin of the muscle of your body.
Mm-hmm.
And it depends on the person, but slowly or quickly, depending on how fast it progresses to the body, it's basically a degenerative disease of the muscle.
One of the most important systems that is affected is the muscular system. As a result of the myelin sheath being damaged, the conduction of action potential is disrupted, leading to impaired sensory perception and motor coordination. Repeated inflammatory events at myelinated sites cause scarring, and in time some function is permanently lost. This causes trouble walking, muscle weakness, and spasms. It affects vision, balance, strength, sensation, coordination, and bodily functions.
It makes it harder for you to do everyday activities. Like I said, at times it can often result in paralysis. You can lose your ability to walk, your ability to be able to eat your food, things like that.
Okay.
The skeletal system is greatly affected by this disease, causing the bones to become weak and brittle. Many times as the bones weaken, they are fractured and broken easily. Osteoporosis is a common disease that people with MS have. It's a disease which can be developed by treatments used to help treat MS.
I threw some food in my mouth, my pharynx and let it down. My epiglottis blocked it, it went down my esophagus. It got to my stomach, not even done with its trip. Through my digestive tract, sphincter won't let it back. This heartburn's hurting, my stomach is churning. Now get ready to start learning. This is digestion, how food makes it from our taste buds to our anus. It's only natural, we all can do it. Eat our food and later through it. This is digestion.
Peg tubes, like feeding tubes in people that can no longer control their ability to swallow correctly without it going into their lungs.
MS has a significant effect on bladder function. It can make it hard for a person to carry out daily activities without discomfort and lack of control. It tends to have an effect on the urinary system in over 80% of those with the disease, and bladder dysfunction happens when the MS lesions prevent transmission of nerve signals from the CNS to the bladder and urinary sphincters. This causes the bladder to become unstable and is not able to hold the normal amount of urine. It can also cause the bladder not to empty properly, which leads to a number of uncomfortable symptoms such as frequent urges of urination, hesitating in starting urination, nocturia, and inability to empty the bladder completely.
This disruption in the endocrine system causes a major disruption in homeostasis. This disruption in homeostasis makes MS a more terrifying disease to live with. It is a sad truth that MS is not true. There's not much that can be done as of right now for a patient that's diagnosed with MS. There's a lot of research and tests and scientists working on, medications that can help people with MS. They're looking at things such as medications that can help the myelin sheath grow back, or some medications that slow the disease from running its course so fast. But as of right now, there's no medication that can treat it. So patients have to look to other ways to try to help them cope as they live their lives, because they just can't stop living. These things include physical therapy. MS patients go to physical therapy and do water workouts where they're in the water and they're held up by ropes or kind of a system that allows them to just flow in the water and kick their legs and move their arms, because their bones become so brittle that it just hurts to put weight on it, or they just can't walk because their muscles won't fire. They also do walking workouts where they have a walker and they just step just to get moving and get their cardio up, because if they're so weak and their muscles don't fire, they're in a wheelchair all day, which compromises their cardiovascular system, compromises their bones and muscles, causing a lot of atrophy in the bones and muscles. Emotional support is probably one of the most important things that MS patients can have. A lot of patients with MS are not born with MS. It's not something that you see a lot of babies having coming right out of the womb. I don't know the statistic, but I'm pretty sure it's really low. A lot of patients who are diagnosed with this disease happen to live into their 20s or even 30s, living normal lives and having no signs or symptoms of MS, and then they get to the middle of their life and they're diagnosed with this disease, and kind of destroys what they know. I know a guy back from my hometown who he was one of the most funniest, lively guys around. And he was 33 when he was diagnosed, and within 3 months, he went from this guy who was cracking jokes, running around, coaching youth league football, to a guy who's in a wheelchair, can't eat, can't move. He's losing muscle mass and becoming skinnier. He's just looking sicker, and you could tell that he's sad every day because he knows what his life used to be, and now he's living this life where a lot of what he used to know and used to do is just taken away from him, and it's sad to see. But as somebody part of his support group, he has 3 sons, and his doctors are there for him. He has a great family support, and you just have to be there for him. You can't be discouraged as watching this disease take over them, because they're it's taking a toll on them so great that it's already hard on their heart, so you have to be there for them. And you know, that's one of the greatest things that an MS patient can have is emotional support through friends and family. So in conclusion, me and my group members have learned a lot about this disease. As a group, we had a basic idea of what MS was, but nothing in depth as we have found here. Um, Sad fact is that MS at this point, you know, there's nothing that can stop it. If you got it, you know, it's going to run its course and it's going to take over your body. So I think what me and my group members have taken away from this is that raising awareness for MS and MS patients is very important. And we've learned a lot, and I hope you did too. Thank you.